please.
Good morning, everyone. It is Friday, February 11th. Welcome into the Morning Medical Update. Thank you so much for joining us here on Facebook and on YouTube. Coming up today, love is in the air. Your heart is beating fast for Valentine's Day, but for some, big emotions might land them in the hospital. More and more women are suffering from something called broken heart syndrome. Dr. Travis Love is a cardiologist here at the health system. He's going to join us to explain exactly what that is and why it is affecting so many people, especially women. We're going to talk about the causes and some possible treatment. We're also joined, of course, by Chief Medical Officer Dr. Steve Stites on this Friday, so make sure you get your questions sent in to us on YouTube, Facebook, and on the Medical News Network. You'll find links on your screen right there. In headlines around the metro this morning, the Park Hill School District School Board voted last night to extend the mask mandate through February 17th. That is also the same day that the mask mandate expires for schools in Kansas City. In the Gardner-Edgerton School District, masks will be optional for students starting Monday. Johnson County leading the metro in vaccinations. 73% of people in Johnson County are fully vaccinated. Leavenworth is second with 57%, followed by Platte, Jackson, and Wyandotte counties, with roughly each having 55% vaccinated. In KCMO, Health Department is opening a new COVID-19 testing site at the Bruce R. Hawkins Cultural Heritage Center on Blue Parkway. The site will offer free COVID tests every day, including weekends, through March 1st. But they do ask you to make an appointment. So let's get to our COVID count this morning. And Dr. Dana Hawkinson, he's our Medical Director of Infection Prevention and Control. Good morning to you.
Hi.
Hi.
Numbers continue to go down for hospitalized patients. 58 active infections with 17 in the ICU and 8 on the ventilator, 97 in that recovery period. We continue to have deaths, though, in the hospital. So far for February, we've had 22 inpatient deaths from COVID alone. So the hospitalizations are trending down just like around the nation, but we see the deaths are still fairly high. We still have a high death rate, and but I think we understand that those deaths do follow hospitalizations as well. But overall, I believe the trend for cases and hospitalizations continues to improve.
So that's some good news, Dr.
Yeah,
Stites.
it's getting better. It's interesting, because a few days ago, Fauci starts talking about returning to what's a new normal, and we see school district masks probably going to come off toward the end of February. And I think in society in general, we're seeing messages about trying to open up a little bit. And I think at some point we're going to have to test that. I would remind our audience and remind everyone, there is still a very high rate of community transmission. We don't want to discount that. Remember, the new tests per day has dropped dramatically, thank goodness, but it's still at one of the highest levels in the entire pandemic. So my advice is, let's keep a close eye on what numbers do. I don't doubt that we're by the end of February, early March, we're going to see the relaxing of a lot of mask mandates. It's probably time to do that. I think what we're going to have to do is then watch the numbers really closely and see what happens 2 weeks after that. But I do believe that we are headed hopefully into a much better spring, Hawkeye. But we're going to test it as we take all the masks off, especially in schools.
Yeah, I think so. And I think the key thing here is that really please get fully vaccinated update. I mean, that should allow you to be out doing things a lot more than we have been the past few months, more back to like when the cases were much lower, but now you have that added protection of the vaccine and the booster, really to protect you and your family from that risk of hospitalization, severe disease and death. So I agree. I think it is all going in the right direction, but we still have to be thoughtful and vigilant in what we do. And if you are part of some of those populations that are maybe more at risk, then just take a little bit more thought into what you're doing and judge those risks and benefits of anything you may be doing.
I think a couple of interesting articles were published yesterday in the New England Journal. One was looking at a study, Hawk, of patients who've had, VA patients who were vaccinated initially with the J&J vaccine, and whether or not they should be vaccinated secondarily with another J&J, what was called the homologous or heterologous approach, where they got a messenger RNA vaccine. It looked like the people who got J&J followed by the mRNA vaccine were doing much better for disease prevention, especially for serious illness and death, than those who got a homologous, that is J&J, again for the booster. So it looks like to me, when I read this, the mounting evidence suggests that if you've had J&J, the booster or shot you should get should probably be an mRNA vaccine.
Yeah, exactly. And I think, the CDC has recommended more that as not a recommendation, but a preference, so a preferred mRNA after the J&J vaccine. This data would help support that as well, and I think it's good. I think what we have shown is that these mRNA vaccines really have done well, provide us safety, provide us efficacy, really done all the things we've hoped they do in that short amount of time since they've been released. So I think it's good news and good data. We know that some of the companies are working on that Omicron variant vaccine. We'll see if that really does come to market, because we know that these current vaccines continue to provide good immunity. We know that you can and have had Omicron-specific antibodies after that boost. We've had good data to support that as well. And most importantly, of course, those T-cell responses are still conserved. So, we'll see what happens with an Omicron-specific variant vaccine. Probably by the time it comes to market, there's going to be one or two more variants out that we're going to be concerned
I think it
about.
will, and I think that the Omicron variant-specific vaccine will be interesting about disease prevention, because you're right. I think the mRNA vaccines do a great job at preventing hospitalization and death. The other quick thing, just to point out, in Qatar, one of the Middle Eastern countries, I think, aren't they hosting the World Cup in soccer soon? They found excellent public health, some of the best in the world, and they track some of the disease around COVID-19 very carefully. Average age of 38, so a lot younger than what we're seeing in the VA or is in the United States. But they demonstrated that prior infection seemed to decrease the risk of repeat issues unless it was Omicron, and then it was only about 56% protective. So vaccines doing a really good job, even boosted against Omicron. Prior immunity from other variants, not as strong, even in a young population with Omicron.
Yeah.
I mean, it was a good study, and I think we have to take caveats with it. It is a select population. There are differences there compared to the United States population as far as age, as you had pointed out. Other things as comorbidities, but I think it is important to know and talk about past infection, and maybe as we get through more times when people are infected more than once. And if you survive, the problem with infection, Stephen, we've talked about this, is that anytime you get infected, you roll the dice with those complications. And so the best way to help prevent those things continues to be through vaccination. But then there is also other published data, more basic science research showing that those 3 exposures to spike, whether it's through 3 vaccine doses or whether it's through 1 infection and 2 vaccine doses, or vice versa, 2 vaccine doses and 1 infection, really continue to provide the greatest breadth of antibody responses and immunity towards spike. So vaccine continues to be the safest thing, but certainly we know that you can get immunity, especially immunity to other things other than spike that are on the coronavirus with natural infection. But the problem is that the complication rates can be significant, and so the best way to protect yourself against those continues to be vaccination.
Yeah, we still have, how many was the day? 150 some odd patients here with the Omicron variant. Jess, it's still hard.
I know that, and I want to just check and see if we have any reporters on the line. But in the meantime, I do have a question from Jonathan at Fox 4. And yesterday, an entire state, I lived in Nevada before I came here, and the entire state opened up the mask ban. No more masks. And so on my feed, people were so excited. Only a few people were like, I don't think this is a good idea. But for the most part, everyone was thrilled. So the question is, if you could, and you touched on it already this morning, but just elaborate on what you think about the drop of the mask mandates, and just as they start to just fall off, as the masks fall off, the mandates fall off, what do you think?
It's a complicated question, right? We have to learn to live with COVID, and it is our new endemic disease. I think what we're going to experience is what it shows us the last few years. The worst outbreaks have been in the late fall, early winter, midwinter time, and I suspect that's not a mistake. That's probably what we're going to keep seeing as the variants arise, and hopefully the variants will become less severe, but there is no guarantee for that at all. They could become more severe. At some point, you have to return to some sense of normalcy, and I don't know the numbers in Nevada off the top of my head. For Kansas and Missouri, I'd say it'd be a little premature because we're still a little high, but you're going to have to start to approach some form of normalcy. What I would say, though, is that if you are immunocompromised, if you have underlying severe chronic disease, if you're over the age of 65, man, I would still leave that mask on, and I would watch and see how society does first. And because I think that's the question we don't know in the United States. There's some early data, and Hawk can comment this probably better than I can, but coming out of Britain, Europe, and South Africa, that numbers drop, But when you have a large number of unvaccinated people, there is a constant drum. There's a constant number of COVID that is higher than it was after other variants because Omicron still spreads so easily. So I think we have to look out for that. I think, again, we're building the airplane while we fly it. We've heard Fauci say the same thing. It's going to be time to start going back out into society. So I think we all have to brace for doing that, trying to make sure that we think about ourselves not as a big society, but in that big society, how is my health and how is the health around the people around me? How do I make sure I protect everyone and then make those choices? I can tell you at my age and in my family, I have I almost called my mother-in-law 99. She's 89 years old. I'm still wearing the darn mask when I go to the grocery store and I go into indoor credit events. But I'm starting to go back to restaurants. I'm starting to do stuff again.
But a follow-up with that is, and also some people are asking, if we don't take out the mask, how do we see how society is doing?
No, I think that's right. I think it's, but you almost have to break it down into your own community of where things are on your own graph, and not try to think, well, because New York tends to be 3 weeks ahead of us, 2 to 3 weeks ahead. So I'd say Kansas City 2 to 3 weeks behind. So I'm happy the school districts are keeping masks on for a little longer, or into late February, early March. I think that'll give us a real sense of where things are. We're going to need to take them off. We're going to let the kids go, and we're going to have to do it in society too. And we take a risk when we do that. I think if we leave our masks on Hawkeye, we take risks with that as well, if only from the emotional and mental toilet it affects.
Yeah, but I think also we certainly cannot minimize those immunosuppressed or those older populations because we know that they are not insignificant, and you may not think that somebody doesn't have a solid organ transplant, so they're not immune suppressed, but they could be on immunosuppressive drugs for some other reason, autoimmune, rheumatologic diseases. They could have just inborn genetic immunosuppression. And so I think it's important to understand, just as you said, about your community and the people around you, because what we do affects others. And that's why it really continues to be down to the individuals really being thoughtful about what they do. And I can't emphasize enough, and we can't go back enough to really getting vaccinated. You did bring up that point about vaccinated populations, and certainly the vaccinated populations as a whole, or those communities, really tend to do better as far as spread, hospitalizations, and death.
So I would say cautious optimism. Yeah. Think about where you are relative to all your risks and that risk of your family, recognizing, masks are going to be coming off, and that's probably okay. But it's also probably something we have to be really judicious about.
Yeah, it's finding that balance between life back to normal and staying safe.
Hey, we're building the airplane while we fly.
I know. Okay, so we're going to talk about heart today.
That's
right,
awesome.
Are you ready?
I'm ready. Let's
do. So almost
heartfelt.
Every one of us has experienced some type of heartbreak in our lives. But did you know that there's a clinical difference between heartbreak and a true broken heart? So much so that doctors are now recognizing broken heart syndrome as a medical condition. Alexis Del Cid explains more.
There's a reason why so many songs, movies, books, and musicals revolve around the brokenhearted, because so many of us can relate to that. From a cardiology standpoint, though, doctors tell us broken heart syndrome is a diagnosis, and it's relatively new, so they don't have nearly the data that they do on other heart conditions. Do you remember the first broken heart you ever had?
Of course I do. The first one and the last one.
How old were you?
17.
What was his name?
Brian.
It could be argued heartbreak is the one universal human experience, whether it's a bad breakup,
probably 22, 23 years old, happened in college,
or the loss of a loved one.
I was really heartbroken when my mom passed away.
We all know that gut punch that leaves you feeling like you may never be right again. And Dr. Travis Love says in some cases, a true broken heart can have devastating consequences.
It can be quite traumatic, and people will end up in the ICU with this, and people can even die from this.
The University of Kansas Health System cardiologist says broken heart syndrome is real. The more technical name for it, stress cardiomyopathy.
Most of these patients present like people who are actually having heart attacks, so chest pain, shortness of breath. A lot of the data that we find on these patients, their EKGs and their cardiac enzymes, are very similar to heart attack patients.
Most of the time, Dr. Love, and yes, that is his real name, says broken heart syndrome is treatable and reversible with medications and time. So it turns out time heals a broken heart is not just an expression either. There are other studies that show broken heart syndrome has become more common in the pandemic, with so many people isolated without their support systems. Doctors say 90% of the documented cases are also women around the age of 65.
Well, researchers at Schmidt Heart Institute say broken heart syndrome affects middle-aged and older women up to 10 times more often than younger women or men of any age. The study suggests that the condition has become more common, with cases rising since well before the pandemic hit. So you can't necessarily blame those broken hearts on COVID. I want to turn to our guest, cardiologist, Dr. Travis Love, here at the health system. How are you?
I'm good. Thanks for having me.
Well, certainly something we can all relate to. And you remember the last time your heart was broken, sir?
Okay, you just asked me that because I just told you. So many times, of course, in my life, but the one I remember the most was when my girlfriend of my first year of medical school broke up with me after 1 year of dating. That actually ended up being my wife. I was very persistent. I had access to really good drugs, and I was able to help. If that's her. But no, I was very persistent. I stayed around. She couldn't kick me to the curb as hard as she wanted to, and years later, she finally figured out that maybe.
So she broke your heart, and then you just broke her down.
That's really what happened.
Okay.
Persistent.
I like your strategy.
I'm like a dog with a bone.
You
right?
are. You just keep coming back.
persistent.
You keep coming back.
A little painful. Others have thought the same thing, that I'm painful.
So, Dr. Love.
Yes.
We already had somebody on our feed ask, do you get comments about that? You're a heart doctor. Your name is Dr. Love. People must make the connection, right?
Yes, all the time. Thought it'd be a lot cooler than it really is.
Right.
It's really a little goofy, but yeah, all the time.
But it's not made up.
Not
You're the real
made up.
Dr. Love.
Not
Okay,
made
so
up.
You didn't change your name.
I didn't.
no. Okay, good. No name change. Okay, so I want to ask you, when people say someone died of a broken heart, someone who lost a spouse after being married for decades and they died of a broken heart, is that possible?
Yeah, actually it is. We found out here early 1990s. We discovered this entity, this stress cardiomyopathy or broken heart syndrome, where we found this form of heart failure in patients that didn't have coronary artery disease, which is often the cause of heart failure. In these patients, they often had an emotional or physical stressor in the days leading up to their event. And so, yes, it's possible.
So it's an unusual emotional event that your body just is not used to, your heart is not used to, it's never experienced it before, and it's kind of sending it into some type of state or mode?
Yeah, so we're not quite sure about the pathogenesis of the stress cardiomyopathy. The leading thought revolves around catecholamine surges or adrenaline surge, these neurotransmitters, and how they affect the heart, specifically certain parts of the heart. And so that's kind of the leading theory on why this happens. People have an emotional response, and then they have this surge of catecholamines and subsequently develop this type of heart failure.
Now let's talk about the history. It has a distinct name. It came from Japan. It was discovered in Japan or first diagnosed there, and it has...
early 90s is when it was first kind of found to be a clinical entity in Japan, and it was initially called Takotsubo cardiomyopathy. It's still referred to that amongst the medical community, but Takotsubo simply stands for or means it's based on the apical ballooning, or the tip of the heart balloons out into a different form than it normally has. And that form looks a lot like an octopus pot that they use in Japan to trap octopus. So that's why they named it that.
So why women?
We don't know. That's a really good question. The most common...
Because men are cruel.
That's what I'm glad you said it and not me, but yes.
I wasn't going to touch it.
No, go there. You can go there.
So we don't know. That's the truth of the matter. About 90% of people afflicted by stress cardiomyopathy are middle-aged or 65 or so year old women, postmenopausal women. And the data on that just isn't clear. There's some theories, but I don't think there's enough data behind those theories to really make an accurate statement about it.
And you touched on it, but the difference between a heart attack and this stressor, tell people the difference. We're not talking about clogged arteries.
Right, exactly. So when patients initially come in, they present just like folks with a heart attack. So they come in with chest pain or shortness of breath. It's really, by story, tough to tell whether they're having a heart attack or something like stress cardiomyopathy. And so it's not until we actually rule out blockages in the heart arteries or coronary artery disease as a cause that we can then make the diagnosis of stress cardiomyopathy. So they present very similar.
And certainly broken heart syndrome is a clever name, but this can come on not just from the morning of a broken heart, but also sudden fear, anxiety.
Yeah.
Is that like, anger? Are these all true to
Yeah,
true
absolutely.
To be?
So any emotional stressor can cause it. Physical stressors as well. Patients who are in the ICU, patients who have stroke, any of these sorts of things can lead to stress cardiomyopathy.
You can jump on in here
You know,
time.
I do have a couple of questions. So how does someone distinguish this from a heart attack, Travis?
Yeah, so like I said, this is really a diagnosis of exclusion, meaning we have to get rid of the diagnosis of coronary artery disease before we can say stress cardiomyopathy. So the best way to do that is a coronary angiogram, an actual invasive procedure where we go in and look at the coronary arteries directly, make sure that there's no blockages in the heart arteries that could be causing the abnormalities we're seeing on the echocardiogram. And if that's the case, then the diagnosis can be made.
And it seems like one of the challenges will be that it's still shortness of breath is a big part of the problem, and I assume that's probably the dominant symptom in stress cardiomyopathy.
Yeah, often. Chest pain also,
Yeah.
a deep substernal chest discomfort, just like patients who have heart attack, can be very similar.
You know, it's got to be tough when these people come in and you say to them, well, you're not having a heart attack, but you have a broken heart. How do people handle that?
It's tough. I think it's hard to explain to people that this can just come from an emotional stressor, or whatever that psychological stressor, or even financial stressors. All of these things can contribute, and just explaining to the patients this is the cause. It can take some time to work your mind around that.
And do you find that the people generally get better on their own, or do they need long-term therapy? What's the recovery like?
Yeah, so this is thought of as a transient entity, and so patients should recover in anywhere from a couple of days to a couple of weeks, usually by 3 months. Just about everybody has recovered their heart function. There is not a treatment that we know of specifically. We treat it like a typical heart failure with medications we use in any heart failure, but there's not great data saying that actually helps.
So when my daughter almost broke my heart because she got married, actually, he's a great guy, so I'm all good about that. And that's a transient thing. I'll get better.
Let's hope. Let's hope.
Yeah, that's what I'm planning is. Okay.
Dr. Love, we cannot avoid our feelings and our emotions, but can we avoid broken heart syndrome any possible way? Or are some people more prone to it than others?
Yeah, so certainly, again, postmenopausal women around the age of 65 are definitely more prone to it. We don't know why, and we don't know how best to avoid that. I think if we know it's an emotional or physiological stressor, then avoiding those things and working on becoming more stress-free. That becomes a lot more difficult, certainly in the last year or two. Can
COVID cause broken hearts?
So I don't think COVID can cause broken heart syndrome. There is some data here recently that suggests that it's more frequent, especially in the last couple of years with around the time of COVID. I don't know that you can say that it's directly related to COVID, but certainly there's more psychological stress, there's more emotional stress, more social stress, more financial stress, and so we're seeing that. We're also seeing more critical illness. People are being in the hospital on ventilators and these sorts of things, which are also reasons to develop this type of stress cardiomyopathy.
Have you ever seen this in young people? I mean, who
does.
doesn't experience heartbreak like teenagers?
They're just more resilient. I think they must experience it more often. So yes, it does happen in young people, a lot less often. So under the age of 35, it's actually pretty rare.
Their hearts can take it.
They can take it.
They can take it. I want to weave in some community questions while we're talking about this today. So let's get to those as well. And one of our questions was, is somebody with an anxiety disorder more prone to this? And how do you know the difference between an anxiety attack and broken heart syndrome?
Yeah, that's a good question. So we think that patients that do have anxiety and depression are a little bit more prone to developing stress cardiomyopathy, which makes some sense, I think, logically. So yeah, I think they're more prone to that.
Is there a sense that all the catecholamines from stress will continue to build up or cause damage to the heart tissue? What do you think is the underlying cause?
We just don't know. That's truly what we think is the case, is that these catecholamine surges are the cause, but we don't know that for sure. And so it's just something that's going to take a little bit more study.
Yeah, I kept thinking all the times I've been super stressed in my life, and I wondered, sometimes you do get a little short of breath when that happens too. We think, well, it's just anxiety. You wonder, is it just anxiety?
Well, that's also an interesting point, because I think this is an underdiagnosed entity. We know of patients that come into the hospital with chest pain and shortness of breath, but there's probably lots of patients that don't present with those symptoms when they have it. And in those cases, we may be missing these transient entities, and patients just may be recovering at home.
Mary asked if you could clarify, people who have blocked arteries can't have broken heart syndrome.
Not exactly true, a little more nuanced than that. So the diagnosis can be made if you have blockages in your heart arteries, but they don't correspond to the area that we see the abnormal motion in the heart. So you can have arteries that have blockages, but as long as this area that is not working as well in the heart is separate from the area that's getting blood flow from that artery, you can still make the diagnosis of stress cardiomyopathy.
Joellen wants to know what your cardiac specialty is.
I'm a general non-invasive cardiologist, so I focus on imaging and seeing patients both in clinic and in the hospital.
And in breaking hearts, evidently, they're trying to repair broken
Right.
hearts.
Repairing,
Yeah.
not breaking.
There you go. So now, are you married?
I am, yeah.
And what's your broken heart story?
I don't know that I have a great broken heart story. It's been broken many times. My grandma recently passed away, and so I think that's been a little tough. So.
Yeah. So, I mean, again, elaborate a little bit on that. When somebody has a loss of different types of losses, I mean, not just a romantic loss, but different types of heartache and loss and pain and loss of a job, loss of financial security, and just different things that can cause major stress and sadness.
Yeah.
And is it linked to depression?
Yeah, so absolutely. All of those things can be triggers. And like we said, depression and anxiety can also increase your risk of developing this. And learning these coping strategies to get around that, treating your anxiety, treating your depression, however that's best done, can be helpful probably in preventing this.
Oh, wait, there's someone we haven't heard from about their broken heart story.
I know, Hawkeye.
Hello, how
So-
are you? You're not getting out of this conversation.
And the hawk nest over there. Let's do it.
I don't think we have enough.
Okay, let me ask
time.
you
Yeah.
this. No, I got
My
it.
broken
How many
hearts.
hearts have you broken? Let's just do that.
He laughs.
Probably none. Probably
Didn't mean to throw
none.
ya.
Probably none.
Okay, so you're not answering. You're
Yeah.
pleading fifth.
No.
Okay.
Yeah, I think people with red hair, they're probably more susceptible. What do you think?
Yeah,
Definitely.
Is that part of
absolutely.
the story?
Definitely.
Yeah, that's what I'm thinking.
There's no doubt.
Redhead thing.
Okay, let me get. I think we have a couple of
COVID
questions for COVID.
Oh my
yes.
It's like it's still out there. I'm gonna
It
start
is almost
seeing
like it's still.
the
Broken
up
hearts
in
and
the air
COVID, they
changing
never
over
go
again.
away.
We're talking about other things other than COVID.
Yeah, well, it was nice for a while.
I know. Okay, so Angela wants to know, Dr. Hawkinson, have you all read or heard about how Denmark is fighting COVID? They are 81 to 83% vaccinated. They're opening everything up, no masks. Most of the older people are vaccinated. What gives with that, and what are they doing, and why can't we get on board with something like that?
I mean, again, I think just as we talked about with the Qatar data, with the Iceland data, we know, the United States is just a different population. Number one, it is bigger geographically. The total population size is larger. We have different communities that are vaccinated versus unvaccinated. I think there are a lot of caveats when you compare the United States to any other country. That being said, we know that, accurate data or truth is truth no matter what population that's in. I think people, just as Dr. Stites had talked about, are wanting to get back to things like they were in the past. I think we need to be cautious in doing that. Vaccination levels do help. We aren't as concerned about the cases per se as we are about the hospitalizations. And I think cases and hospitalizations are two different things. I think, the vaccines, what are the vaccines for? The vaccines are really meant to protect against hospitalization, severe disease, and death, not necessarily against infection, although we know it has that benefit in some instances. So I think if we can get on board, and I think the main goal here, whether you're masked or unmasked, the main goal in our country should be to get everybody vaccinated. We know, unfortunately, there are groups of people who don't want to get vaccinated because maybe they don't believe in the vaccine. Maybe they don't think it's safe. It is obviously safe. It has been given in billions and billions of doses. It has proven to be much more safe than getting the disease. In addition, people sometimes just don't want to be told what to do, even if it's the right thing. We are seeing that play out right now in Canada with the truckers' protests. So, unfortunately, some people still don't want to get vaccinated. Vaccination continues to be the safest, healthiest way to get through this and to continue to open up. I'm not sure about Denmark's hospitalization and death rate, but we do know that a lot of their older population is vaccinated. So if we can keep our most vulnerable populations, whether that's age-based or comorbidities or immunosuppression-based, keep them protected by vaccination, but also get the other healthy people vaccinated as well. I think that we can start to do that, just as Dr. Stites alluded to earlier in the broadcast. And, I'm still hanging my hat on that vaccination is the way that we are going to continue to be able to release or decrease some of these mandates, get back to doing those things, get back to those large gatherings. But it really is incumbent upon every person to get vaccinated, to protect themselves, because I still believe vaccination also does help decrease spread in some form or another as well.
Can we show the New York Times heat map for just a minute, guys? So, this map looks so much better than it did just a few weeks ago because it was solid purple just recently. And now you can see it beginning to lighten up in various areas of the country. And I think one of the things to recognize is that, especially in the Northeast where it's so much lighter, that there's a combination of factor. This is really hybrid immunity. The hybrid immunity means that a lot of people have had COVID and a lot of people have been vaccinated. So if you step back and look at the data, for the ages, we talk a lot about vaccine resistance, but isn't it interesting that for those who are over 65, that 95% of Americans have been vaccinated, and 89% of people are fully vaccinated. Now, that's a pretty stunning statistic. So vaccine resistance, probably not such a big factor if you're over 65. So the more you felt at risk, the more you've decided to be vaccinated. So it's funny, we fight about vaccines still. And people still want to think about, I'm going to go prescribe ivermectin, or I'm going to go prescribe hydroxychloroquine, or I'm going to do inhaled colloidal silver, and all these things that are not shown to have any efficacy, in fact, are probably dangerous to you. And then you look back, you step back, and you say, vaccination really has very few side effects. And it really does protect people over the age, especially the older you get. So if we could just kind of let go of some of our fear around vaccine, we can also let go of some of our fear around COVID-19. And that's what really helps people get back to normal. We haven't seen the overwhelming surge coming out of nursing homes this time with Omicron because so many people are vaccinated. And I think it clearly demonstrates that if you can be vaccinated, and I'm going to throw another part in here, and I know you'll believe too, Hawkeye, it's vaccinated and boosted. You really got to get the booster effect because that clearly shows the impact of it. Yeah. And finally, a report yesterday, I forgot where it was in, looking at women who are unvaccinated and the high risk of SARS-CoV-2 causing issues with the placenta and stillbirth. Yep. So for young women, both because you don't want a broken heart, you want a healthy pregnancy, get vaccinated. One last point, the United States has a much higher death rate from COVID than other wealthy countries, and the answer is we're not as vaccinated. And we're seeing it play out in our hospitalizations here. If you look at the people who are dying from COVID, almost all of them are either unvaccinated, that's the biggest percentage, or undervaccinated, meaning they haven't gotten their booster.
Yeah, it's all about vaccination, being up to date, just as you said, fully vaccinated plus that booster. So I think that's extremely important.
Dr. Love, Angela wants to know what part of the heart is affected by broken heart syndrome?
Yeah, so all parts of the heart can be affected, but most classic is the tip of the heart that balloons out. One of the problems with diagnosing the disease is actually that's the part of the heart that's affected by the largest heart artery and the scariest heart artery when it's blocked. And so that tip of the heart being affected is really an important factor. It's a good question.
Okay, so I have a question. If somebody comes in with this, do you ask them personal questions about if they've had a recent life experience, stressful event? Because and when you diagnose them, do you say you may have broken heart syndrome, or do you use that fancy technical medical term?
So we typically treat all of these patients like they're acute coronary syndrome or that they're having a heart attack. You do get questions with that have to do with emotional stress because that's also a trigger for having a heart attack. And so, we ask those questions, but more to get to the answer of acute coronary syndrome or having a heart attack rather than this. And then if we find that there are no blockages in the heart arteries, then we rework the diagnosis.
Then you proceed with that. And I ask that because Shirley is sharing a story with us this morning. We appreciate you. At 67, her husband of 48 years passed away within 37 days of diagnosis of his illness. Within 7 months, I took myself to the emergency room. They found no blockages or reason other than maybe possible indigestion. Would you venture to guess that this was broken heart syndrome, Dr. Love?
It's really tough to know and to make that diagnosis without having images of the heart. Certainly, that's a really stressful event, and I'm sorry, Shirley, that happened. chest discomfort can come on for lots of reasons, and so it's a possibility, but it'd be tough to make that diagnosis without further.
I took myself to the ER once thinking I was having a heart attack. Of
Yes.
course, it
Did
was
you
acid.
have broken heart syndrome? You
I
should- wait
did
a
not.
minute.
I had acid reflux. I had acid reflux.
Let's take a time out here.
Get
What
her,
was
Steve.
your most recent big heartbreak, Jess?
Well, I remember my first one.
Yeah.
My first one.
What was it?
Jeff.
Jeff. You just called him out.
Sounds like he
Don't
knows
even
who
get-
he is.
Don't even get me started with Jeff. No.
There you go.
I mean, I don't remember.
You just sniffled about
I don't
it right
remember
there.
sophomore year. I don't even say where I went to school, but anyway. So yes, I do remember. No, I had my heart broken so bad, my mom had to come over in the middle of the night and make sure I was still alive. So I get it; it's a real thing. But yeah, but I mean, I remember taking myself to the ER thinking that I was having a heart attack because women do that. It presents so strange, and they couldn't find anything. And at the end, I had acid reflux after a big old bill, and
Sure.
someone saying, "Sorry, we can't find anything wrong with you." So
Yeah.
for women, I can see where they would come in thinking it was one thing and it turns out to be something else.
Why, I've seen this in some men, but why the preponderance of women? Is it because men are cruel? I wonder.
No comment.
Just in general, I mean,
Hawkeye?
I think no. I think men
Okay.
tend to be dumb. I don't necessarily mean cruel, but
dumb and
maybe
Maybe
It could be-
emotionally blunt too.
they
Right.
could be all three. They could be all
Obtuse.
three.
All of that.
Dumb, cruel,
All of
and,
the
and-
above.
dumb,
Okay.
cruel, and blunt. We're getting hammered. This is good.
I know. Sorry, you
Right,
brought
Jess.
it on. Okay, so question from Catherine. Is broken heart syndrome a sudden onset condition or can it develop over time? That's a good question.
Yeah, great question. So we believe it to be a sudden onset syndrome, and oftentimes 1 to 5 days is the typical range where we'll have patients tell us their emotional or physical stressor was before they present with chest pain and shortness of breath.
Where does GERD fit into this? Fanny wants to know.
Yeah, it definitely fits in. A little bit different, but similar presentation. You can have chest pain or epigastric pain and present with similar symptoms to a heart attack. And so that's something else. Typically, the way we work through this sort of diagnosis is take care of the bad stuff first, kind of rule it out. So coronary artery disease, which is the most common killer of Americans in the United States here. We get rid of that as a possibility, and then we can focus on other things like stress cardiomyopathy and gastroesophageal reflux disease.
I find it no coincidence that women are the ones experiencing this all the time.
Oh,
So
listen,
very
I got plenty of reflux. I really want a little extra reflux. I'm happy to give it to you.
I know you are.
Yeah.
I know you are.
Yeah,
So
I
we had
wanna
some
eat
great
chocolate.
questions today. We're going to get to our final thoughts. Then we're going to share some thoughts from our group here on the Morning Medical Update. But Dr. Love, thank you so much for being with us.
course,
We
happy to be
appreciate
here.
it. Right
Yeah.
before Valentine's Day.
Sure.
The Love Doctor, Dr. Love. I know
Oh, Lord,
people
here
were
we go.
loving your
Paging
name.
Dr.
People-
Love, yeah.
Yeah, so just what do you want us to know as we head into the weekend and just taking care of our hearts? It's Heart Health Month, of course, here in February. So
Yeah.
what do you want us to know?
I mean, I really like to focus more on coronary artery disease. Like I said, that's a really big part of, death in the United States. And so staying active, staying healthy. It's tough in the wintertime to get out and exercise, but especially with the pandemic and having trouble getting into gyms or whatever. But you got to stay active in whatever way you can. So nice day today. Get out, move around, and try and stay healthy.
Is coronary disease still the number one killer of women?
It is.
All right, let that sink in. Dr. Hawkinson, final thoughts from you today.
Yeah, I mean, I think that's a good message from our guests. We've always talked about getting outdoors and being active and doing those things, especially help to reduce stress during the time of the pandemic. I know I'm going to be trying to do that this weekend. I was told by a patient this week that I looked fat on TV, so I will be out enjoying the nice weather, walking or running outside. I think everybody should get out. If you haven't been vaccinated, go get vaccinated. Maybe after your walk or after your exercise, I think that would be a good thing. Be up to date with your vaccinations. And I would just like to say happy belated birthday to my father as well. It was his birthday yesterday, so he is 73 years old now, and hopefully he will continue to have many more years. He is fully vaccinated and updated, so I feel that he is protected, and I'm glad about that. And if you know other people who are not still, please go get them vaccinated.
Oh, happy birthday.
Yeah.
Thanks for sharing those fun pics,
Yeah.
Dr. Stites. Yeah, get outside, get some fresh air and sunshine this weekend, right?
You know, I think that's right. And exercise a lot. I did that since I wasn't going to the gym as much right now because of Omicron. I hope to get back here in another week or two. I was been doing a lot of Peloton workouts at home. Allie Love and Hannah Corbin bar classes. Men for bar. That's an excellent way of keeping your back
Are you doing
loose.
plies?
I am doing plies.
Okay, that's
it's
all I needed to
ugly,
ask
but
you.
I'm doing them.
Okay.
And I love them.
Just need to
because
clarify.
Exercise makes a difference. Here's what I also know. Everyone is loved by someone. Don't break their hearts. Stay vaccinated. Stay safe. Make sure you take care of yourself so you can help take care of everyone else in your life who loves you and everyone that you love. Because at the end of the day, I think Lin-Manuel Miranda said it best, and love is love is love. And I'm not just talking about the cardiologist.
Okay. Yeah.
Miranda quote, huh?
Yeah.
He is the best.
He
That's
does
his
it.
favorite.
Live long
His
and
fave.
prosper.
I
There you
love
go.
it. I love it. I love
There
you
was a
get-
Star Trek episode of The Broken Heart. Picard had to have a heart transplant on Star Trek. Awesome episode.
I think we should actually lobby for him to write the next Star Trek movie.
Picard?
No, Miranda.
Miranda. I would
Oh.
love
That
that.
would be a
That would be cool.
the
we
collision
digress.
of your two worlds.
I would
It
be. It
would.
would be Broadway and Star Trek. It's awesome.
Okay, thank you all for being with us today. We appreciate it. It was a Good Friday show. So you can catch our show anytime on Facebook and on YouTube. But very important, set your timer because next Thursday we launch a brand new show called All Things Heart. It will be hosted by Alexis Del Cid. She will kick it off with several great episodes about the effects of COVID on the heart. But through the entire season, we'll focus on a variety of topics like transplant, epilepsy, even the effects of dental work on the heart. Again, All Things Heart starts February 17th and will air every Thursday at 10 a.m. So please join Alexis. Bring your questions about All Things Heart. And coming up Monday, it's Valentine's Day, and men seem to forget that, among other things like anniversaries and birthdays too. So the big question is, why? And you can't blame this one on COVID either. We'll find out about that on Monday. And yes, Monday is Valentine's Day, so time is running out. Get on it. A study by WalletHub.com found that 58% of us still value romantic gestures more than ever, even since the pandemic began. So I did to give you a little friendly reminder when you walked in.
That was helpful.
And you said you need to get on it.
I'm
so
going to get on it.
what
I'll be out there tomorrow.
do you guys? Some people kind of frown on celebrating Valentine's Day. Do you guys celebrate it?
We do.
You do?
Yeah,
I
my
love
wife, my
that.
wife's very clear about that. No. She's great, and we definitely still celebrate Valentine's Day in my household after 38 years.
Okay, what do you usually get her? Jewelry?
No. It's more. We're more the candy flower kind of
Yeah,
thing.
just time.
It's
Take
good
a moment.
stuff. And there's somebody else in our health system that has a big birthday Sunday. Tammy Peterman, the president of our
Tammy Peterman.
campus.
Oh,
I don't know if
fantastic.
she's leaving right now, but listening, but she'd be mad at me for saying this. But she turns a year younger on Sunday.
Fantastic. Happy birthday,
Happy
Tammy.
birthday. Right in front of Valentine's Day. 2 big days in a row.
Dr. Love, no pressure on Valentine's Day. What do you do for your wife?
We're going out of town. We got 2 young boys. We're going to take them skiing, snowboarding in the mountains. So we're just going to spend time together as a family.
Yeah, but it's almost like
great.
family time. That's sometimes what we like to do.
It
as
is.
family.
That's the best.
And I don't like jewelry. I like food. Food's my thing. I actually got bacon, I think, once. Sorry.
Is there a problem with that?
There's zero problem, except that we have
Thank
a
you.
cardiologist
I
sitting
love
at the
bacon.
table.
Oh,
But
I
yeah,
bet.
bacon.
Do you eat bacon?
I do eat bacon.
Yeah, bacon. Bacon's a food group. Come on.
Bacon is love. Please know
Bacon
this.
is love.
Okay. All right. So here is a way into the hearts of some of us here who bring you the morning medical update. So everyone, please have a great weekend, and we'll see you back here Monday at 8.
I love to play golf, but man, it is just too cold to get out in this weather. But I also love chocolate. Here's a great idea: chocolate golf balls. And they come in 2 flavors.
For Valentine's Day, my taste have simplified quite a bit. I just like a cool pair of socks.
You might be asking yourself, what does the kitchen have to do with Valentine's Day? Well, at least for me, it involves at least the air fryer because I want a heart-shaped platter of tacos and chicken wings.
What I'd like for Valentine's Day is a gift card to Quick Trip.
This is my recommendation for the best Valentine's Day gift ever of all time. It's what I made for my husband last Valentine's Day. I was very proud of myself. I made him a beef jerky bouquet and asked him to be my meat heart. I know that doesn't sound romantic, but we've been married for 20 years. I wanted to spice things up.
Ladies, it worked.
What I would like for Valentine's Day? Maybe some tickets.
What I like on Valentine's Day is ice cold beer. Don't worry, Joe. It's root beer.
What was that noise, Cliff? No, I'm not worried. What I want for Valentine's Day, a big mushy card from my husband and a nice hug and kiss from my daughter.
Subscribe to our morning medical update and open mics with Dr. Stites podcasts. Now everywhere podcasts are available.